Namaste everyone. My name is Dr. Vaibhav Avasthi and today we are going to learn how to draw the anatomy of right eye with eyelids separated so as to see the structures within it. Now, the symmetry of the diagram is already done so as to save on to some time. However, here we need to remember that this will be the external appearance and this will be the internal appearance. So first let us begin with the shape of skull. Now let us assume that this is the first half of the skull bone. So we will come down with a line like this. Then we will draw the margin of the skull bone. Here we will show the bony protuberances. Now we need to draw the jaw half. So this is the first half. Now, similarly we need to draw the second half of it. The second half will be external appearance. We are going to draw that part as a dotted because that part will be behind the hand. We need to draw hand over here. We will come to it in a while. Now once we are through with this, let us begin with the left section first. Now on the left side, to begin with, spherical eyeball. Now inside this, this is the medial ligament. Followed by the lateral ligament. So this will be lateral ligament. And then in between so that this and this becomes the tarsal plates. Now above this we have to show the lacrimal sac. This entire part is the lacrimal sac, followed by the lacrimal canal, and the lacrimal gland on this side. Now, over and above this, we have muscle that is levator palpebrae superioris. We are going to name it on this side. Now, once we are through with this, then we will go to the nose ka section. Now, in nose ka section, this has to be the middle meatus and the inferior meatus. Some bony extensions. Now, let us draw the nerve which is present above the left eye. So this will be supratrochlear nerve and this will be infratrochlear nerve followed by supraorbital nerve. Alright, once the supraorbital nerve is done, let us come down to few more bony extensions. Let us draw the dentition and the jaw. Now let us consider the dentition. So these are the teeth which we are drawing one besides another. Then let us draw a muscular part here. Alright, now the structure on this side. So first what we need to do is, we need to follow this. Okay, we need to draw a hand which has to open up the right eye. Okay. Let us consider the hand. So let us say the index finger, followed by the thumb. and let us close the hand over here. Behind this index finger, let us consider another finger. While then coming to the nail part. So this has to be the nail. Alright, now within this, the structure of eye, step by step we will follow this. Let us draw a spindle shaped structure first. Spindle shaped structure. Then this spindle shaped structure we will double it up. Now, inside this we will consider the lens and the eyeball. Let us say this is the eyeball and this is the lens. Followed by the pupil. Next, this is the Caruncula. And then we need to draw the eyelashes. Fine. Once through with this, then the nasal part. And the nostril. Lower down to the lips. right? Okay, now in this entire section, let's draw a few more nerves on this side as well. And the remaining has to be the skin fluid. Alright, Acha, what about the hair? So let us fill this up with hair. So on this side, since this is external view, so we will find hair here. So let us have wonderful hair on this side. Followed by the ear. On this side we can see the external ear, that is pinna. And this pinna is not visible here because this is the bony part. This is the internal appearance. Dotted line indicates that the structure is posterior to the hand. Alright, fine. Now let us name this. The diagram is almost ready. Well, this is called as levator palpebrae superioris. This part. See, here I go. Levator palpebrae. Let us clear out space. Superioris. Right? Okay. Then moving on to the next part. This is lacrimal sac. This bluish part. Okay, the rounded part. Then just besides the caruncula, here we have the lacrimal punctum and the lacrimal papillae. So just beside this rounded body you come out. Okay, let us take the naming on this side. Lacrimal papillae and the lacrimal punctum. Next, now inside this there are small holes. These are the orifices of tarsal glands. Orifices of tarsal gland. Now these orifices are present here. These are tiny opening. Next, then what we have is the pupil, followed by the iris, followed by this margin which is called as plica semilunaris, this margin. let's take the naming out. Plica, semilunaris. Rounded body, very important. This is called as Carunculus, or we can call it as Caruncula. Moving on, next. Then this margin of the lens, this will be sclera. And out. Followed by these covering. This is the conjunctiva. Conjunctiva, which is covering the sclera. Alright, let's do one thing. Let's name this as conjunctiva covering the sclera, and this margin let us take it towards cornea. So let us put this as cornea and this as conjunctiva. Both are transparent membrane which is covering the anterior surface of the eyeball. Coming on to this side, this nerve is a supratrochlear nerve. Supra, why? Because it is on the upper side. Then this nerve is a supraorbital nerve. This nerve on the lower side is infratrochlear nerve. Infratrochlear nerve. This gland, this is the main tear gland. This is called as lacrimal gland. Lacrimal gland. Then this is the orbital septum. Followed by the lateral ligament, lateral palpebral ligament. Then these are the tarsal plates 1 and 2. Then this is the medial palpebral ligament. Medial palpebral ligament. And then on this side we have nasolacrimal canal. Nasolacrimal canal. I hope this all naming is visible to you. If it is not visible to you, I'll adjust the camera setting. Just hold on. Okay. And then on the lower side, this is the inferior meatus of the nose. Inferior meatus of nose. So what do we see in this diagram? In this diagram what we have seen is, this is the structure of right eye, anatomy of right eye. So this is the anatomy where we are focusing on right eye with eyelids separated. Right? Alright, take a screenshot of this.